Welcome, everybody. I know we're still having some people trickle in, so we can give a minute or two, but really appreciate everyone joining for the call today. Really excited about the conversation we're going to have with some of our teams here and how they view AI, how they went about rolling it out, and then where they're looking moving forward with some of those tools as well. So yeah, let's go ahead and get started. So my name is Nolan Rothwell. I am the team lead of our enterprise customer success department here at Prompt, and I have some awesome people on the call with me today, all who I've worked with really closely over the last almost a year and a half now. Yeah, Dave, why don't you go ahead and get us started with just a quick intro, and then we'll go to Mike and then Larissa.
Sounds good. Dave Manzo with Atlantic Physical Therapy Center. We have 38 locations, pretty much central New Jersey, along the coast. We worked with Nolan and went live with Prompt in June of 24. Nolan, thank you for all of your work. And we look forward to spending time with you guys today.
Good afternoon, everyone. I'm Mike Evangelist. I'm Senior VP of Clinical Services for JAG Physical Therapy. We have about 170 locations between the states of New York, New Jersey, and Pennsylvania. We have been on Prompt since October of 2024 and working very closely with Nolan since that time, and very happy to be on here today.
Hi, I'm Larissa Shaps. I'm the VP of Company Operations for Spooner. We are in Arizona and Texas, and we went live with Prompt on April 7th. And Nolan's my new best friend that I haven't met in person, but we've had a lot of phone calls and text messages.
Soon. I know we got some good in-person stuff coming up for the rest of this year. But yeah, like I said, thanks everybody so much for joining. So what we're going to do is just start off with a poll question for everyone is joining remotely. And the poll question is going to be, how has AI rollout gone for your teams? So you'll see that poll question pop in there. And then, yeah, just to get us started here, I'm curious from kind of everybody, what initially motivated you to adopt Prompt's AI tools? And then the word AI, I feel like sometimes people get a little bit scared of. Did you have any concerns or hesitations with turning on some of those features?
So I can get started there. The reason why JAG Physical Therapy was interested in the AI tools is really our growth, our desire to grow in our footprint in this environment, and some of the requirements that our payers have on us. It's very important to be able to give our clinicians the best experience possible, and to be able to continue to deliver the gold standard quality of care that we've expected over the last 20 years. As far as hesitations, I think for us, the hesitation was we have 2,000 employees, and we want to make sure that there was buy-in from all of our employees, because that's important. But for us, that was the reason.
I would just add, we really didn't have a lot of hesitation. We've always seen ourselves as kind of pioneers in the space and adapting to new things to set us apart from our competitors in the space. And we knew early on when we made our decision to go with Prompt that part of their roadmap and the features that they had set them apart from their competitors. And so we were eager to jump on all those features as soon as possible.
Yeah, all the same things. I would say it's always been our guiding light to treat the employee right. And if you treat the employee right, then they're going to treat the patient right. And with all the AI tools that Prompt has, we saw that as a way to make our employees happier. And we've rolled them out. And we have a unique approach where our CEO and COO still do a couple shifts a week. So they're in the front lines and they're boots on the ground. So they work in a lot of these tools, and then they message out from a top-down approach, and our staff really buys into everything that they talk about. So it's been a good way for rollout for us as well.
Yeah, and I think you hit on a good point there, Dave, especially with some of the larger teams. I think sometimes it gets missed being in the day-to-day operations and really seeing what this tool can do. And I feel like everyone on the call today does a really good job of that. Like, where do you guys find that piece really makes a big difference with not just saying, hey, here's this new thing we have, but also being able to say, hey, I've played with it, I've done it, I've used it, and being able to get a little bit more buy-in on some of these kind of new features across teams. Larissa, any thoughts on that one?
Yeah, we have a team of dedicated therapists that are part of our professional development team that help with clinical development. And so there are boots on the ground, like giving firsthand experience and adapting to it, and then sharing their knowledge with the rest of our team. In addition, we select therapists that are very tech savvy and then those that are not so tech savvy. So we get the spectrum of experience, and it helps us figure out where we need to go with our training to the masses to make sure that we are helping everyone adapt to the technology and the features to make it as efficient as possible.
Mike, anything you want to add on that front?
Yeah, similar. I mean, similar to for us when we came on to Prompt, we basically trained a team of super users, both from the regional clinical side and also on the regional office manager or patient access side, to ensure that if there are any questions coming from the field, that we had multiple resources for them to reach out to. And that was a huge help. Thankfully, the tools were very honestly easy to use and to adapt to. So there were not many questions, but we definitely had the teams ready in the field.
Yeah. Yeah. And Mike, for you guys specifically, obviously with the amount of clinics you have, I think AI intake's a good example of that's one that a lot of teams that I've worked with have maybe brought on like a smaller pilot to test out first and then have expanded it to their whole team. Yeah, I think you hit on it there with just, and Larissa mentioned this too, with trying to have a full spectrum in a pilot of not just like your tech savvy ones, but also everybody else. I'm curious, once you guys turned that on at some clinics, how did you assess, A, is this working? And then not only is it like a positive impact for the clinicians, but also are there any other benefits or things to consider about the full patient experience? And at some point deciding, okay, this is great for everybody, we're going to scale it up.
Nolan, I think it's a positive impact, actually, certainly for the clinicians, but we also looked at it as a positive impact for our administrative staff. With that AI intake, patient comes in and they're ready to go. So we sold it per se to all levels of the company. This is something that's going to improve everybody's work-life balance up, we'll call it. Clinicians are getting evals teed up, ready to go, and the patients are walking in and their data's all teed up and ready to go. So it's improved everybody's life in the company.
The only thing I would add to that, because I agree with Dave, it's like when you're going to your team to share the new features or like digital intake as an example, you're really speaking to like, how is this going to benefit them, whether that's front office or therapist or back office, but then also how's it going to improve the patient experience and making sure that you're speaking to each one of those, because everyone wants to know what's in it for me and what's in it for my patient. And so we did a lot of training at our front office, and honestly, we're still continuing to dive deep into the value of the communication prior to the patient even doing the digital intake. And communicating to the patient, the more thorough you fill it out, the better this is going to assist you in your outcome in physical therapy, because you're going to show up for your first appointment, they're going to take you right back in, and they're going to be able to get started on that initial evaluation right away. And they already know a little bit about you. And so just educating too on the communication around how it's going to help with the patient experience and then the workflows and efficiencies of the entire operations.
Yeah, and I think that's a great call out. I think at baseline, the AI intake is really helping clinicians document faster, right? I think almost any team that uses Prompt is always looking at that specific metric. But what you mentioned there, Larissa, is that the intake isn't just, it's a lot more specific now, right? The AI intake is going to ask about home, work responsibilities, prior level function, current level function. Yeah, I'm curious, have your clinicians also felt that they almost have a better head start on their patient for that eval and maybe even being able to jump right into a little bit more treatment on that first session versus spending so much of the time on the history taking?
Absolutely. The very first patient that we rolled it out with, my therapist sent me a text message and my patient hasn't walked in the door and I know that they work at Home Depot and they have shoulder pain when they lift things overhead. And I'm like, that's amazing to that granular of level. They know that much information.
Yeah, it's something that the clinicians in our company had never experienced. We're all creatures of habit. We were doing this a certain way for so long. I think my best comparison for our company too is that when we came on to Prompt, we went from paper flow sheets to digital flow sheets. People were very hesitant about that, the thought of it, and then realized how advantageous it was. And I actually think that I think that helped this transition a little bit because they knew that we're going to implement something, it's probably going to work. And then just after a few weeks, clinicians and patient access were seeing the benefits, as David and Larissa were saying.
Yeah. Yeah. And outside of just the AI intake, but also thinking about like case summaries and some of the other AI tools that we offer, as you guys have turned some of those on, are there any unexpected benefits outside of just your clinicians that you guys have noticed, whether it's for the admin or even the patient experience itself?
On the admin side, I feel like the case overview summaries from a compliance standpoint, we obviously educate and train therapists to make sure that they're changing up their objective and their assessment and things that they're doing. But as the day gets busy, they might carry over part of that note. And so it really flags to say, hey, you haven't changed this, or you need to modify this, and giving that like feedback right there and then versus hiring an employee to go in and do chart audits all the time. It is providing that feedback prior to even signing off on the note.
I think it gave the digital intake also gave the patient a little bit more autonomy because they can truly tell their story directly. Sometimes when it's going from patient to therapist, something that the patient felt is important may not be taken in by the therapist all the time. And so now that gives the patient more autonomy to tell their story through the digital intake, I think, which has been great.
Yeah, 100%. I think a lot of times when you're filling out intake paperwork for any medical service, it's almost the exact same thing every time. It's very generic. It doesn't necessarily dive into all the specifics. To me, as a patient, I would almost be drawn to, oh, like this is really asking some of the things that I'm coming in for, and hopefully creating a little bit of almost more of a bond of what's important to Spooner or Jag or Atlantic in terms of helping people get back to what they want to be doing. Outside of the AI intake, just switching gears a little bit, Prompt obviously offers a lot more AI powered tools. I think the biggest one that I have seen the most impact from is the waitlist and the plan of care compliance. I'm curious, as you guys have now transitioned to Prompt over the last 12, 6, and 3 months, how have you guys seen the plan of care compliance tool and waitlist affect your visits or any other metrics that you guys keep a close eye on?
I can take this one right away.
Okay. That's good.
Go, David. I'll follow. Go for it.
No, I was just going to say, obviously there's cancellation rates, right? And all offices deal with that. But I think the fact that it's changed the process for the business, right? In the past, make a phone call, right? In the past, maybe you don't even make that phone call, and visits would have fallen off, and there's probably more of a fluctuation in weekly visits. I think now it provides the practice more consistency on your weekly visits. So you may have cancellations, but your visits are still staying the same, which improves the flow of the entire business, and it gives you cash flow stability that maybe you didn't have in the past. That's just one way of looking at it. Larissa, your turn. You're probably going to do better than me, so go ahead.
We've been on Prompt for 5 months. And so our first 5 months, our scheduling features were about 6% of our volume, which we were happy with because before that, it was all manually done by our team. And we have seen it bump to August to be around 7%. Our goal is to have 10% of our volume be scheduled through plan of care compliance, waitlist features. Hopefully it will get even further down the road with that. But where we are now is like really optimizing Prompt to figure out like what's our sweet spot with staffing, because we are seeing, because of these features, that our team is not having to spend time doing the mundane tasks of calling and working a wait list or working off a spreadsheet or things written on paper to call patients. Like it's all automated. And so now they have that time to provide either a better patient experience and or they have more time to be doing higher level functions. And so we're in this sweet spot right now of like, how do we really optimize these features and really get our ROI with partnering with Prompt, but also to elevate like the experience that our team's providing.
Yeah, and I think one of our profession-wide challenges is it's not the actual delivery of care. We're all really good at that. It's getting the patients in the door to deliver that care. Our model of outpatient therapy is obviously 2 to 3 times a week, depending on the plan of care, different than maybe a dentist once every few months or whatever it may be. Making sure that there's that automation now that is there has been a game changer. For us, again, prior to Prompt and prior to the AI features, our process was very manual as far as the lost patient log and our patient access teams and clinicians being involved in that. The amount of work hours that was needed to get patients back on schedule sometimes took away from, again, the patient customer experience. And so this waitlist opportunity has been a huge benefit.
Yeah, I think with the plan of care compliance and waitlist specifically, I think when teams first decide to turn that on, there's always a little bit of fear of, are we sending too many notifications out to people? Do we lose a little bit of the personal touch that's gotten us here? But on the flip side that I call out is the only people that are going to get these invites to come in for another visit are ones that are not booked according to their POC, right? So that patient that scheduled out everything exactly as they should, they're all set. They're not going to get inundated with more messages. But all those patients who are maybe falling below their POC, which again, as you guys mentioned, it's all about the patient at the end of the day, right? If they're only coming in once every 2 weeks and they're supposed to be coming in twice every week, their likelihood of getting better and getting back to what they want to do, it decreases, right? So that's how I've always viewed that. And I'm curious, how have you guys come up with a talk track as you've switched EMRs to get that buy-in for the patient and make them aware of like why they're receiving this instead of them just seeing it and ignoring it?
We really have started from the very beginning of the first time we're calling the patient to get them on the schedule for their initial evaluation, like talking through them the value of the digital intake, but also communicating with them like they are going to receive communication via text and email, and this is what it is and this is why. And then our therapist, once they're in the initial evaluation and they're giving their home exercise program, doing that reminder to say, you will receive continual communication if you're not scheduled out for your full plan of care. We just agreed that we'd like you in here 3 times a week. So if we're not scheduled 3 times a week, you will receive communication to try to get you on the schedule if there's availability. And so just, again, over communicating. And so it's just a part of the process versus like the patient walking in saying, I just got 3 text messages from you and I don't really understand what they're about. And so we're having those conversations early on with the patient so they understand that's just what we do.
Yeah, I totally agree with Larissa, and I think we heard more of that when we actually transitioned, right? Because the patients, the current patients that were coming were like, oh, all of a sudden I start getting these texts. I never got these from you before, but now it's part of the full experience, and we do message it as well. And I don't think the patients, we don't hear a lot of people saying, oh, I got a text from you. Turn it off.
Yeah.
It's normal. I know in my everyday life, I get texts from other organizations that I've done business with, and it feels normal to me. So I don't see that as a barrier.
Yeah, absolutely. Oh, go ahead, Mike.
No, I was going to say, I know that Prompt has logic built in where if it's short-term waitlist opportunities, long-term waitlist opportunities, POC reminders, it is logic built in so there's not too many messages going out to that single patient, not to overload them. So that's helpful.
Yeah, absolutely. And at the end of the day, obviously, a lot of these tools are built around getting the schedules more filled, getting all your providers seeing the appropriate amount of patients. But Dave, with the rapid growth that you guys have had over the last couple of years, I'm curious if you've seen any other kind of trickle down effects of your team not having to do all of those manual admin schedules and how that's correlated to your ability to grow and scale.
Yeah, so we did a little exercise, and Larissa and I have talked about this, where we looked at our patient visits July last year versus July of this year, and our visits have gone up 24%. And then we coupled that with our phone volume. So we have our call system, and we looked at our phone call volume and to see how much that went up year over year. So we had a 24% increase in patient visits, but only an 11% increase in call volume. So we know that something's being done. And coincidentally, we changed to prompt in June of last year. We're seeing the efficiencies there. We're also seeing it on our billing side. We're also seeing it on our copay collection side with the kiosk. That's probably worth talking about as well. But we're looking at that all the time and ways that we can run the company more efficiently. And we're seeing it. So it's working.
Yeah, and with any of those tools, whether it's some of the Prompt Plus features or kiosk, and you guys already hinted at this, but a lot of times there's fear about like losing the personal touch. Have you guys noticed that has been expressed, or have you maybe found the opposite where, your teams are able to actually have more of a conversation instead of having to be the one to always ask for money at the front door and things like that?
Sorry to jump in, but I think the kiosk has given the opportunity for the office staff to talk more to the patient rather than in the past. It was like sometimes the phone's ringing, somebody's at the front desk, right? And the other line's ringing, and the front desk is like going bananas. Now the phone's not ringing as much. Patients, one of the things we do is we have canvases on the walls that has the schedule your appointments here. So we've put that in all the offices. So we've just given more power to the patient, really. And if I'm standing in that patient position, I'm like, wow, this is pretty cool. I can do all this stuff myself. And not that I don't need the front desk, but now I can have a human conversation rather than give me your money, give me this, give me that. So it's just made for a better experience.
I would add to that, we've had NPS since 2015, and our highest NPS for a year was 90. So the last couple of years we've been at a 90, and year to date we're at a 91. And that's with transitioning to a new practice management system. And really, we believe part of our team has been able to be more patient focused through this transition, but also like our patients have more control of how they get their physical therapy care. So they're in control of being able to schedule and utilize these features, but also like their experience has been magnified because we have better features to take care of them when they're in our clinics.
Mike, anything you'd add from your end on that one?
No, I would mirror everything Dave and Larissa said on that one.
Awesome. And then, Mike, for you specifically, you guys have obviously launched all of Prompt's native AI tools, but I know you guys have also been working with Prediction Health and rolling out their sidekick. How have you found that those have layered on top of each other, and how's that kind of impacted just the overall clinical experience?
Yeah, so Prediction Health Sidekick has been a tremendous compliment. We actually rolled it out to 30 providers across 30 different clinics in the company with outstanding results. Clinicians, all 30 of the clinicians are beyond happy with it. It significantly decreased their time to documentation. We also tried it across different specialty services and same results across all services within Jack Physical Therapy. The initial evaluation specifically, clinicians love to complete initial evaluations. It puts their diagnostic and assessment tools to the test. But what they don't love sometimes is the component of documenting an initial evaluation. And what we found is that has Sidekicks essentially eliminated that. They're more than happy to take on that kind of last minute initial eval, that post-op that might call that needs to get in the same day because they know that they have Sidekick and it's reduced their time so much. So it's been a huge positive across all 30 of those providers.
Yeah, that's awesome. Obviously, for all of you guys, like you're all incredible at building new process, scaling things, but obviously AI in general is relatively new to all of you. I'm curious, like, what's your biggest learning been from combining different tools, whether it's POC compliance with the wait list, with AI intake? What's really allowed you guys to use those to their full impact? And yeah, I guess is there anything that you learned along the way?
All right. Uh, I think we're unique in the fact that our leadership is boots on the ground. Like my brother Mike's the CEO, but he still does two shifts a week, and he probably gets pulled in a little bit more than he should. But the fact that he's on the ground doing these things and he's talking with the clinicians all the time, I think that's been a really good thing for us that he can relate and talk to them on a clinical level. So I think that's just been a plus for us in rolling out these tools.
Yeah, I feel like AI is where everyone is right now. And so if you're not an early adopter, you're not keeping up with where we are with technology and how we can be more efficient from an operational standpoint and mindset. I think when it comes to rolling out these AI features or adapting them within your practice, it really takes strategy and intention to make sure that you're bringing your whole team alongside you so they understand the why, right? And like for us at Spooner, we have our whys of why we transitioned to Prompt, and a lot of those are very similar to why we're adapting to all these new features within Prompt to maximize the experience. And so anytime we roll something new out, we pull those whys front and center to everybody. It can be a tech, it can be a PSC, RCM, therapist, but making sure that we stick to those and then we speak to the importance of a growth mindset, adapting to change, and as professionals and leaders that we go about giving it our best shot and be open to change because it really does come down to the behaviors of us as humans and whether or not we're going to be open-minded to the change and we're going to really put our best foot forward to adapt it. And so that's what's allowed us to adapt it early, but also to make sure that we are getting the best possible experience out of it.
Yeah, it's about staying ahead and the technology is there. So why not use it? We just Dave and Larissa's companies, it's very important to show our employees that we're trying to do everything that we can for them and also for all of our patients. And it's been a great experience to this point.
Yeah, that's great. What advice would you guys give to clinics who are maybe a little bit skeptical or hesitant about adopting the AI features or yeah, just AI in general?
Yeah, for me, I think the future is now, and it's an inflection point right now in our profession. And if you think back to the 2004 to 2010 era, and I'm completely dating myself in saying this, but I do remember at that time that there were PT companies that were switching to EMR and some that were staying on handwritten notes. And that obviously evolved in 2010. More than 50% of companies were on EMR at that point, and that's obviously grown to, I think, over 95% at this point. And now we're at that point with AI, right? So I think it's going to happen for each specific company. It may not be this actual moment that it's the right time, but I do suggest that it's something that should be looked at very closely because there are obvious benefits and advantages of adopting AI capabilities.
Dave, anything you'd add on your end with that?
Well, I would say for us, it's giving as much time as possible back to the clinicians. We've improved the documentation time, right? Since making the switch, our internal reporting, they tell us taking half the time to do documentation. So that's the clinician's time is so valuable, and that's what this business is all about. And with staffing the way it is, it's obviously most clinicians across the country are getting busier, right? Because there's just this shortage of staffing across the country. So any which way you can give time back to the clinicians to let them be to better serve the patients. And then we're trying to do things on our side to always make sure the clinicians are happy, right? Because if the clinicians are happy, then ultimately the patients are happy. And so we're just going to continue to look for ways to improve that delivery and make it as efficient as possible in a way that the clinicians appreciate it. And it's simple, but that really is like the guiding light.
Yeah, absolutely. As we look forward, this is not the last AI feature that'll come out. There's going to be a lot more opportunity as time goes on. I'm curious, as you guys have started to plan for 2026, are there certain areas that you guys are all looking to maybe explore AI, or where do you see AI maybe helping further down the road outside of, as a lot of the things right now are more clinical and admin based?
I feel like it's a question that we could probably go on for 2 to 3 hours. If you dream about it, it probably could happen. I think some of the things that I think about are AI-driven patient re-engagement tools that could be based on a patient's job responsibility, based on an athlete and their season, when they're most likely to get hurt, things like that. Automated home exercise program refresh. If an in-clinic flow sheet is changing, is that something where it drives an AI tool to basically send that change to the patient? And then also interconnectivity, more as we have opportunities for more interconnectivity with hospital-based and physician-based EMRs. How can AI help how can AI help all of our companies with prompt in order for example, maybe a medical record that comes through from a physician where there's a follow-up coming with the physician, and that drives that information straight into the physical therapist. So a lot of different things to think about. I think the future is there though.
I love all of Mike's ideas.
Awesome. Dave, anything else from your side on RCM, or Mike? I know if Brian was here, you'd have some additional thoughts on the pieces there. But yeah, Dave, anything from your side?
Yeah, we are continuing to see efficiencies coming through. And I know it's the work of the programmers doing what they do behind the scenes at Prompt. Our billing team on RCM, right? We haven't added a biller since we went to Prompt, and I've talked about some of the growth that's happened. That's not by accident. It's because of the AI features that are happening and the things that are happening behind the scenes. A lot of it is like Prompt just keeps giving it to us. We'll certainly accept that, and it helps. But yeah, it's been pretty powerful.
Yeah. Yeah. And let's say a new AI feature came out tomorrow that, and we already talked about how you guys go about maybe selecting like that pilot group, but I'm curious, like, how long do you guys typically roll things out in more of that pilot phase? And then, Larissa, maybe you can speak to this one. Like, how do you guys validate that, not just by anecdotal feedback, but the data showing that this is impactful and worthwhile for our team to have?
Yeah, depending on the product, we typically pull whatever KPIs we can prior to the pilot. So for example, we are not on Prediction Health, but hopefully we'll be piloting within the next couple of weeks. And so we've selected our therapists that are going to pilot. We have 6 different KPIs that we want to track, like their pre-behavior and then what's it look. We're going to do 30 days. And after 30 days, does it move the needle on visits per week or revenue per visit or timeliness of documentation being done? That like pre-work, so we have something at the back end to objectify. Yes, this is a feature that's going to give us back some ROI. And then we also do surveys out to the team, like usually anywhere from 5 to 10 questions, 0 through 10 this, or what percentage of your documentation was done during this time frame. So we get both the objective information, but also just some subjective feedback from our staff, depending on what the pilot is. And then so far, everything's gone well. We've been able to roll it out and execute it. Hopefully that's true with Prediction Health. I love Mike. We're gonna have to connect on Prediction Health since you guys just did your pilot.
Definitely.
Yeah, and Mike, for you guys with the Prediction Health pilot, outside of just documentation time going down, what other metrics were important to you guys as you have reviewed some of the data from that?
We not only were we involved with Sidekick, but we also have intel as far as compliance. We were looking at the each clinician's audit scores, as you said, time to documentation, and then we're looking at patient retention, things along those lines. So those are scheduled capacity, a lot of different metrics to verify everything we were talking about. But one of the most important is, just like you guys were saying before, making sure that we survey all 30 providers. We basically sent them a survey of 30 different questions, and it was overwhelmingly positive for all of them.
Awesome. Let's open it up to another poll question here. What AI features are you most interested in? So we'll give people a minute to put some of that stuff in there. And then we've had some great questions come in that I'd be curious. I don't think I can answer all these. I think it will require you guys a little bit. First one, do you encounter therapists who might feel threatened by AI? Larissa, you hinted at this one with just like your broad spectrum of therapists and tech savviness. How have you approached that conversation?
Yeah, great question. We have not. Even though we have different individuals as far as their skill level and knowledge of technology, we've really, again, have stuck to our why for prompt. And again, that really aligns with all the features that have been rolled out. And at the end of the day, it's to give back time for our therapists or our people. In this situation, we're talking therapists, so clinicians. It's to give them back time to be able to do what they love to do and why they got into physical therapy. And I think we've talked about staffing briefly, but therapists got into physical therapy, occupational therapy to take care of people, to treat the patient. And so if we can allow them more time with their patients to operate at the highest level of their license, that's really the mindset and approach we've taken. And we haven't had any pushback with it.
I think you bring up a great point there too, that with all of your team's leadership styles, it all starts from the top. Like I think if the positivity about, hey, we have this new thing, but here's the why and here's why it's going to be helpful, I think people tend to buy in on that stuff because if they don't, right, they're not necessarily fitting with your company culture versus
Yeah.
sometimes if, at the top, it's not as positive overall messaging, like people definitely follow that and resonate with that. And I think it's a little bit harder to get some of that buy-in. Mike or Dave, any thoughts from you guys on that?
We didn't Honestly, we didn't have any clinicians have any issues with AI at all. We didn't get any feedback from anybody saying that they were against using it. I'll go back to Sidekick for a second. There were a few clinicians that initially, when you looked at the amount of hours they were using Sidekick at the first couple of weeks when we implemented it, they were low because they were hesitant at first. But once with the help of the Prediction Health team, they understood how to use it correctly, and then they started to see the benefits. You started to see their hours of usage go up and up to the point where they were using it all the time. And one component I think that's important that I didn't mention in the previous question you had, Nolan, for all of us on here being prompt customers, is that I think utilizing all these tools that we're talking about is very important for all of us as far as our retaining our clinicians. Dave mentioned it before as far as staffing shortages, and that's a nationwide issue. We now, as prompt customers, in my view, have an advantage as far as retaining our clinicians because of the technology that we have, and it'll also help us all as far as our recruitment of clinicians. So I think that's something that may not be as measurable, but I think it's important.
And Mike, you brought up a good point there because there's a couple different ways that you can leverage Sidekick, whether it's with auto note or dictation. One is basically ambient listening, the other one is more just talking through it at the end of the session. Did you like what's been the overall feedback from your team? Because I also think it's very much dependent on the clinic setup and which one works better for you. But did you have a lot of people doing it one way and maybe switch over, or what's worked well with your clinicians?
Mostly the ambient listening has worked well for them. I would say overwhelmingly.
Awesome. And then other couple of questions in here. I'll throw this one to Dave. So I've got a question. We have a good deal of our patient population that does not trust or is very reluctant to fill out paperwork through prompt. Any suggestions on how to get these patients on board?
I think Larissa touched on it. It starts at the first intake, the first phone call, right? Educating the patient as much as possible. Hey, we're going to be sending you this email to fill out. You're going to get this notification. Please take advantage of it. It's going to help our therapists provide a better care for you. And if you think about it, like Larissa said, the story about the Home Depot employee, how valuable is that? That employee or that worker or patient walks in the door and the therapist knows that about them. So it's going to make the experience better. That person is going to go home and be like, man, this therapist, this guy was amazing. Or this girl, how they knew so much about me. And I just felt like I connected with them. And what's that going to do? It's going to drive patient loyalty. And then it's going to drive your NPS scores and it's going to drive your overall business. And those people are going to come back to Mike, the therapist, because he was awesome.
I love that. Noel, if I can just add to that briefly, we've seen this in certain pockets where, oh, our Medicare population, they're not going to do the digital intake because they're older and they like to do paper, or our Medicaid population, like they're not going to. And we had to do a little bit of myth busting in those situations. Fortunately, we're large enough where we have demographic spread throughout the valley. And so in pockets, we're able to say, look at our Medicare population is actually at 90%, or this Medicaid population is at 90% of completion. And what it really comes down to is the training of your team. It's not the patients really, it's really how your employees are speaking and teaching and coaching to it. And so I would start there versus, oh, the patients don't want to fill it out. I really think building them the skill and the confidence to deliver the message like Dave was speaking to is where you will see the completion rates increase.
Yep.
Yeah, and I'd like to add one more thing to that. It really is all messaging. I want to just share one story of success. So our Georgetown, Brooklyn office, which is one of our highest volume offices, 10 plus clinicians, super busy office, and their intakes have been incredible. So they're at actually a 100% digital intake completion rate, and that is very difficult. So kudos to our patient access and clinical teams at that office. And it's all in the messaging and it's employee buy-in, but then also getting the patients to understand the benefit that they would see. So it can be done, definitely.
Yeah, 100% on board with you guys there, right? Whether your eval length is 30, 40, 60 minutes, whatever it might be, like that first session goes by pretty quick. And I think if the patient is feeling like they're spending a bunch of time on intake paperwork, but they're not seeing the why, they might be more hesitant to do it. But when you spin it as, hey, we're going to know what you're coming in for, we're going to know exactly what you want to get back to. And if you can pitch it that, hey, we can probably spend 20, 25 more minutes with you getting better on the first session versus just going over this really high level stuff that isn't a good use of our time. I think that's a really good way to get by in there too. Dave, for you guys have scaled kiosk unbelievably and have really one of the higher utilization rates of any customer at Prompt. I'm sure you saw that early on where some clinics were getting a ton of buy-in on that, and then maybe some other ones weren't. How did you see that for teams that didn't get as high of a rate of check-in? What was there something they were doing differently than some clinics that were really optimizing it?
It's funny. There's a story. I have a little story. So we rolled out kiosk in all of our offices, and we went to this, and it was like all hands on deck, right? So I was running around putting out kiosks and stuff like that, and I was working with one office manager in one of our locations, and she's awesome. She's so great with the patients, right? And she just was not feeling it for the kiosk. And she was like, I want to help my patients. I want to help my patients. I can do it. I can do it. I can do it. And we message it as there's three types of patients. There's the ones that the first time come in, they're going to be like, I won't do it. And we tell all of our staff, go and do it with them. Okay. And then the second time, I don't know, 50% of those patients are going to go and do the login. No problem. They don't need you anymore. Right. Okay. And there's going to be 30% that are, oh, I can't do it. So go around, show them again. And you're eventually going to get it down to maybe, I don't know, 10% that are just going to be like, I'm not doing it. I'm not doing it. But we still tell our staff, get up, walk around, stand with the patient. So just like feeling that. But this one office manager was like, I just want to do it for my patients. And I was like, okay. I was like, listen, we're going to let that go for a little while, but eventually we're going to have 37 clinics that are doing kiosk, and you're going to be the only one not doing it. And she was like, oh, okay. Next time I came in, it was all into it. And we've seen the way that it's helped us with copay collection, scheduling, all the different functionality of it. It's been pretty cool. Just
Yeah, I'm sure you guys all feel that no matter how many times you say something, right? Like at some point people tune you out. But if there's another clinic director or someone else that's, oh, this is really working for us, they tend to listen a little bit more. So I think you can put the proof in the pudding there.
Yeah.
It doesn't have to come from you.
And you have to get through that. It's like on when we did the transition to prompt, the patients that are coming right now are used to one thing, right? So then when you roll out the kiosk, I didn't have this last time. This is a new process we're doing. And then eventually those patients are going to discharge out, and the new patients are only going to know the kiosk. So there's going to be friction in the beginning, but you just got to work through it, and
Yep.
it's going to get smooth, you know?
Awesome. Let's open it up to our last poll question for today. As we end, are there any AI feature requests or workflows that you guys would like to see? We'll toss that one up. And then I think just as we kind of wrap up, this has been really helpful. I appreciate all three of you guys for joining. Is there anything else that we didn't cover today that you think is worth mentioning about whether it's AI specifically or just how you guys have scaled out those features? And if I just ran a perfect meeting, that's okay
No,
too.
you crushed it.
Nolan,
You
I'll
crushed
give you a
it.
little credit, Nolan. Thank you for all the work that you did on our rollout, because that was not an easy task. And I will say that obviously our staff was initially upset with it, and and there was a lot of blind faith for us to go into this, but eventually that it turns, and the staff has been really happy with the tools, and it's helped the business as well. So it's checking all the boxes. So thank you to that.
Yeah, and Larissa hinted at this before too, but it certainly makes it really easy from the prompt side when the teams that we're working with do have a growth mindset, right? The whole reason of switching to prompt is not to do things the same way. You're coming here because you want to do things differently and you want to find a better way forward. So really looking at all of your different processes, all of your different workflows, I think is the most important piece that we covered together in onboarding, and really getting an understanding of, okay, is this the way we want to be doing this, or is this the way that we've had to do it because we didn't have some of the things available? Believe me, you guys have all made my life very easy with just how open you all were to trying new things and taking a look at how and the why of how you guys operate your businesses.
Yeah, I have to follow up with that, Nolan, because we would catch ourselves in the rollout, our administrative team going back to the old way we did things, and we're like, nope, like we'd have to hold each other accountable to come in with a whole different mindset of just because we did it one way and had to create our own workflows, that's not how we're going to bring those old habits or behaviors over. So we have to start from like a clean slate and really just figure out how do we optimize these features, and it might look and feel different. Simple things like terminology, like what a new patient is to prompt is not a new patient to us, right? And so like understanding those definitions and those little things just to get everybody on the same page.
Yeah, change is constant, and having Nolan, you and Prompt as a partner has been huge. We're not obviously physical therapists. We're not the professionals of EMRs and the features of the EMRs, but you guys are working with us to make us professionals in operating our EMRs, adopting those features. That's key. And thank you.
Yeah, absolutely. Thank you so much, Dave, Mike, and Larissa. It's been awesome. Really appreciate you guys cutting up some time from your busy weeks to join us. And yeah, thanks everybody that joined remotely. Really hope you guys got some value out of this. And yeah, we'll talk soon.
Thanks,
Thank you.
guys. Have a great day, everybody.